obviously rough sleeping is a significant and growing problem, unfortunately, in the UK. There's some quite terrifying statistics in a way that, numbers of rough sleepers increased by 165% since 2010, 120,000 in temporary accommodation, and the number of people in temporary accommodations at its highest in over 10 years. So actually, in practice, 11% increase in the number of households assessed by local authorities either homeless or threatened with homelessness. And it's unfortunate, really. It's a very visual demonstration of the challenges that local authorities and housing associations are facing, helping everyone to achieve what is effectively a fundamental need. And I think from a UK government perspective, there is a recognition that prevention of homelessness is a really urgent priority for the UK and requires some really collective and coherent action. So today I'm delighted to be joined by Neil and Claire. And I've kind of done a brief intro into their roles, I will ask them to introduce themselves, but I'm just going to give a quick outline of today's webinar. So we will start with a short Q&A, which is questions that we've received from the audience, those of you that have joined the webinar today. And we'll explore a little bit how social landlords are successfully rehousing people who've experienced homelessness. Neil is then going to talk us through a recent case study where he's worked with Denbighshire Council, which was about recommissioning their supported housing services to improve quality and value for money. And then we will talk with Claire and Neil about how Newcastle is utilising the UK government's rough sleeping initiative funding around ending homelessness in Newcastle, and some of the insights that they've learned along the way. And then finally, and I'll actively encourage you all really to submit questions as we go, but we will have a short Q&A session at the end. Please do push those through, and I'll do my best to kind of pick those up and direct them as they arrive. So I'm going to first ask Claire to introduce herself, and then Neil can follow up. So over to you, Claire, initially. Thank you.
Thanks, Paul. Hi, everyone. My name's Claire Knox. I'm a programme lead in commissioning for Newcastle City Council. And I suppose the remit of my role is fairly broad, in that I am responsible for the day-to-day commission and procurement activity of all of our non-adult social care services. So that includes everything that is public health related. So that's our sexual health services, stop smoking services, drug and alcohol services. I'm responsible for domestic abuse commissioning activity and also homelessness. And I think it's fair to say that my background over the last probably 8 years or so has been around homelessness prevention activity. So we have gone through some quite significant system changes within our homelessness services. We have a very, very strong prevention agenda in Newcastle, and we do an awful lot of consultation and engagement with our provider market so that we can really effectively commission services that will respond to our ambitions, which are very much focused around making the prevention of homelessness everyone's business, and working towards ending rough sleeping and ending homelessness in Newcastle. So the commissioning of our rough sleeping initiative services also sits within my remit as well. So I think it was just a really good opportunity to work with Neil and with Bloom around sharing what it is that we do in Newcastle. So thanks very much for having me.
Brilliant, thank you, Claire. Really appreciate that. And Neil, just over to you before we get into some questions. Thank you.
Thanks very much, Paul. Yeah, my name's Neil Morland. I'm a housing consultant. I started my company 10 years ago. We work throughout England and Scotland and Wales with national and local governments, housing associations, voluntary organisations, and other agencies. And all of our work is focusing on making sure that there's adequate housing for everyone, basically. It's a fundamental belief behind our work. me and the team that work alongside me have got a huge array of unique knowledge and experience. We use all of that to help our clients improve their services and their strategies to deliver better housing solutions for everybody. So yeah, that's what we do.
Fantastic, thank you, Neil. And I'm going to kick off a question that we've received in advance of the webinar today, and a short follow-up as well, which I'll come on to. But and I'll direct this to you, perhaps initially, Claire. What do you feel is important to you and therefore kind of Newcastle when developing sustainable solutions to rehouse those affected by homelessness?
I think from our perspective, Paul, it is very much kind of having that consultation and engagement process, and I don't think you can really underestimate the importance of it. So in Newcastle, we have quite a mix of accommodation offers, everything from hostels. We don't have any night shelter type provision, so we don't have any shared sleeping quarters or anything like that. But we did have some fairly large hostels, and our pathway is very much kind of going into short-term relief accommodation, then that staircase model that takes people into supported accommodation before they would then move on to greater independence. And what we have set out to do through our recommissioning activity is actually look to move from that hostel-led approach to a housing-led approach. So for us, it's important to get our market on board at the outset, where we set out our ambitions and how we envisage we will move to that next stage within the term of the contracts that we've got in place. And it's very much around exploring the assets that the provider market has, because in Newcastle, when it comes to our homelessness prevention services, we don't directly deliver any of the assets ourselves. So when we commission, we ask our market to say, what will you bring to bear in terms of your housing solution to fulfill the specific need that we set out in our contract and our service specifications. So it is very much a journey, and it's very much a partnership approach. And we recognise that in itself has challenges, because we have to use the assets that are currently available, within the city. But we are now starting to see that shift. So our current contracts have been in place now since October 19. And we have seen, in that period, we've seen the closure of one of the biggest hostels in the city, and that has now been redeveloped and is offering, instead of 52 bedrooms in a shared environment, which in itself creates some quite challenging circumstances for the provider, they're now delivering 36 units of self-contained accommodation. So we're actually starting to realise that shift, and for us that's absolutely fundamental to help us realise our ambitions.
That's brilliant, Claire, and I guess in a sense you are quite reliant on partners to provide that sort of accommodation by the sounds of things. I know we have kind of done some work previously with Shelter and kind of their centres in the city. And I assume that they are kind of people that you will be in regular contact with to kind of consider what is how sustainable is this in the longer term.
Absolutely, yeah, and we have we've got strong working relationships both with Shelter and with Crisis. We've entered into a partnership with Crisis to end homelessness in Newcastle in a 10-year period. So we're 2 years into that partnership now, right. And we're also exploring through that partnership a housing first approach. So again, we are considering what we can provide as a city to not only match accommodation to need, but also test different accommodation models and see how they will prove to be sustainable, for those individuals, and that the support will be in place to enable people to have their needs met as they continue to live as independent a life as possible as they move towards full independence.
Understood. Yeah, makes perfect sense, Claire. And I guess over to you, Neil, in terms of a bit of a follow-up, I suppose. But what are the sort of key factors that local authorities, housing associations need to consider when developing their plans?
I think that there's a couple of things that they're all centered really on the theme of communication and cooperation. You know, none of this could be done by one organisation alone. And I think there's a national conversation at this current time with a report out today suggesting that there be a duty to collaborate put in force in England. That's come from the Kerslake Commission, which was set up by St Mungo's and various others to look at what we did well in the pandemic to tackle rough sleeping, and how we could learn some lessons from that. There's a national conversation in Scotland as well around a duty to collaborate being put into place there. And this was previously considered when the Homeless Reduction Act was going through Parliament, with the what we have now as a duty to refer. Originally, that was a duty to cooperate, and when the legislation was first introduced into Parliament. So there's a legal principle that says there behind that thinking that says everybody has got a responsibility to work together to prevent homelessness. And I think it's fine that you have a legislative position that encourages that. And indeed, there are already legal duties to cooperate in various forms for adult social care, children's services and housing associations. They already have a duty to cooperate with local authorities to tackle homelessness. But I think the best cooperation happens well outside of that, really. Like all cooperation, it's not necessarily a piece of paper that makes you cooperate. You know, lots of people have got a marriage certificate saying they're supposed to cooperate with each other. It doesn't mean that they will. Actually, cooperation happens because people choose to work together. And I think that's what we saw from the pandemic. We saw a huge amount of people energized to collaborate and go well above and beyond what they normally would have been expected, let alone what they were expected of at a time of particular acute national need. And yet people did go above and beyond because they saw ethically it was the right thing to do. And so local authorities with health partners, voluntary organisation partners, housing associations, all worked really hard to cooperate with each other to prevent homelessness. And saying cooperation happens because people trust each other, and because people value each other's organisations and the work they do, and value each other as professionals. And so I think it's giving ourselves space to develop those professional relationships, because actually the more you've got trust in your colleagues and the more you've got a strong professional relationship with each other, the more you're likely to do stuff for each other well above and beyond any protocols or legislation or procedures that might be in place.
Yeah, and I think that's a really good point. And you know, one of my next questions was about kind of the impact of COVID-19, and actually what you've articulated there, Neil, is actually that really did bring people together to try and solve a common problem. But do you feel that will continue, or do you think, you know, we will see it, you know, in terms of a positive impact? Do you think it's kind of made organizations realize that actually collaboration is, you know, really can work and help people?
Yeah, I think there's a huge amount of goodwill that's been generated between organisations as a result of the work they did together during the pandemic. And you know, it was tough times for people personally in their home life, let alone then having quite a uniquely challenging situation at work to contend with. But people really rose to it, and to deliver the outcomes from the Everyone In initiative, particularly in the first lockdown, required a lot of staffing resource, required a lot of money, and required quite intense working. But we were all able to achieve that and do that quite successfully. And I think the question therefore is, are we, as a nation, are we prepared to continue on keeping that funding going at the rate that funding was made available at that time? Have we got the staffing capacity to keep that intensity of work going at the rate that was going at that time? And I think we should be prepared to fund it, and I think we should be prepared to find enough staff to deliver the response. Whether national or local government can or will choose to find the money, that's another matter.
It's always the $1 million question, or £1 million question, if you pardon the pun. But I guess, Claire, from your point of view, what do you feel are some of the the challenges that perhaps you're experiencing about, you know, receiving funding, making that case for kind of new social housing type projects?
I think the challenge that we've always got, Paul, and I'm sure you know, the participants of today's session will agree, is around the short-term nature of funding. You know, and any local authorities around, you know, around this webinar will know how many different requests we were made from MHCLG to bid for various pots of money, and some of it was just, you know, based around the cold weather fund, for example, or it was, you know, a limited initiative around Protect Plus. So there was a lot of time spent in what was really a high pressured situation anyway, given that we were responding to the pandemic in its very early stages, to try and put in really comprehensive bids to MHCLG. And I mean, we've been very, very fortunate that we've been able to demonstrate our need in Newcastle for the interventions that we've been funded for. But I think our conversations with MHCLG are very much around, ask us what it is that we need in Newcastle and we will tell you, because quite often, you know, a prospectus which is fairly you know, specific in terms of the criteria that funding is being awarded for, isn't necessarily always responding to our local need. So we're fortunate that we have a very good working relationship with our MHCLG advisors, and we talk an awful lot about what our challenges are in Newcastle, which I suppose specifically are around people who have got accommodation, because in Newcastle we find that people don't sleep rough because there's a lack of accommodation. It's because they don't want to use the accommodation that's there, or they are choosing to spend time out on the streets and are possibly begging or engaged in other sorts of, you know, street activity. And our other challenges around people who come to Newcastle from other authorities. So approximately and fairly consistently 50% of the people who we find rough sleeping in Newcastle are from out of the area, and it can be quite a challenge to reconnect people successfully back to where they're from. So we've spent an awful lot of time working with our fourth sector groups in Newcastle, so that they have a partnership approach to working with us to try and support people off the streets, rather than to sustain people with food, with sleeping bags, with tents, and sustain that life on the street. So for us, it's very much around, you know, trying to make sure we've got interventions which are responding to what our local challenges are. But definitely the short-term nature of the funding opportunities can make it quite difficult to really affect some real system change.
Yeah, yes, and I understand, and actually, you know, even more broadly than homelessness into kind of other areas, you know, it's a similar thing. It's there's some short-term funding available, but what is the longer-term aspiration for that funding? I think perhaps needs some clarity. I'm gonna move on now. There's one kind of other area that I want to explore, but perhaps we can pick that up in the Q&A at the end. But I was just hoping to hand over to you, Neil, to just give us a little bit of an insight into a case study at Denbighshire Council around delivery of housing solutions. So I'm going to pass you over to Neil, and he's going to talk us through that. Thank you.
Okay, thanks very much, Paul. As I mentioned earlier on, we work with local authorities all across England, Scotland and Wales, which is great because housing is a devolved responsibility. So the different parliaments in those countries have got different approaches to housing strategy generally, and also particularly homelessness within that broader framework. And that's allowed those governments and local authorities in all those nations to innovate and allow homelessness policy to particularly, and homelessness law, to really flourish actually in a way it might not have done had it remained centrally controlled. And so I'm sure most people here will be aware that both the Scottish Government and the Welsh Government have used that devolved arrangement to really push forward the boundaries of homelessness legislation and do new things with the law, effectively create more rights for more people at an earlier stage and over a longer period. And so we've seen in Scotland the removal of priority need and intentions to remove local connection and intentionality in due course. And we've seen in Wales the introduction of a prevention duty a couple of years before England then went down a similar sort of road. And it was part of that legislative change in Wales and the impact of that the work with Denbighshire Council came around. Again, as part of devolution, Wales also chose to keep a programme that some of us may have loved and known in England, which was Supporting People. Supporting People was a programme run under the new Labour government from around about 2002 to 2009, and was really about modernising commissioning of housing-related support services and driving up value for money and driving up quality. Again, the devolved nature of government meant that England and Scotland brought those programmes to an end, but Wales kept that programme going as part of a centralised programme run from Cardiff. As the Wales Housing Act 2014 came into force and homelessness legislation there modernised, there was a real push to bring together what was being commissioned around housing-related support and what the new homeless legislation in there was being asked of local authorities. So the supported housing would be seen inextricably as delivering outcomes for homelessness duties. And so against that backdrop, I was asked to look at the current supported housing services that were being commissioned by Denbighshire Council. And like a lot of local authorities, of course, Denbighshire Council had faced a succession of funding cutbacks across the council and its entirety, and also in relation specifically to its housing support budget. And so it was trying to commission as much as it can with an increasingly reducing pot. And of course, at the same time, need was going up. And then new homelessness legislation had come along and had effectively required the council to do more, give more help and advice and assistance to more people over a longer period of time. So less money and greater expectation on the local authority. There was a portfolio of providers in Denbighshire delivering a mixture of short-term supported housing schemes, services that were intended to help people transition from their emergency and then go through supported housing and then be able to move on from supported housing into planned settled housing at the end. There's a range of providers operating a number of different services. We went in and did an in-depth audit of all of those providers and all of those services, of which some of those hadn't had an audit for a number of years, again, due to a lack of capacity in the council to do that work themselves due to budget cuts. We were able to give a clear indication to the council for all the services they were commissioning at the time as to whether they represented value for money, what quality that service was providing, and how effectively that service was interlocking with homelessness duties that the council now had through the Housing Act 2014 in Wales. We came to the conclusion that really across all areas, across value and in relation to quality and in relation to how those services could complement the prevention agenda, that all of those services would benefit from being recommissioned. The specification they'd been set to work against was one that predated the homelessness law changes. So inevitably they weren't going to ever quite satisfy what homelessness law was asking of local authorities now, because the spec was written before that legal change came into force. And that a lot of the specifications were again based on when funding environments were different. So what we did with Denbighshire Council was refocus what the specification of the services might be to interlock against prevention and relief duties, and made sure that supported housing that was available in the borough was first and foremost there to help the local authority to fulfil its prevention or relief duty, and that was its primary function and purpose. And we also then looked at how we might attract viable bidders. When you're commissioning, you want a choice, you want a legitimate choice, and you want a decent choice. And it could well be that existing providers were the best, and that's and would win in the competition, and that would be fine. But it's still good to have a marketplace to choose from, and even if you're going to continue commissioning your existing providers, to know that they've competed in a marketplace and they've won in that marketplace, and they've proven themselves against a good quality competition. So one of the things we looked at was with them, and we agreed with them, was that first of all, they would award longer contracts than what they did previously. A longer contract duration would allow providers to do more. It takes some time for providers to set up a service before it then gets going, and before you know it, the contract's coming to an end, and then you're trying to exit. And that's one of the criticisms we hear regularly about the funding from the UK government, where it's not MHCLG anymore, is it? We've all got to learn the new acronym, the Department for Levelling Up Housing and Communities. So awarding longer term contracts, that's one of the things we did, and we pushed the envelope on there to say, actually award a contract length longer than electoral term, because that then takes the political dynamic out of the commissioning, and it takes it out of it pushes it beyond budget envelopes as well, to say, you know, subject to council funding, this will be a 5-year contract or more if procurement allows it. And so it gives providers a decent period of time to really get their teeth into delivering the contract. And the longer the contract, also the more the provider can actually bring to themselves in kind. Often they don't even know they're bringing to the contract, but often they will bring their own resources and what have you that aren't costed into the contract, but they're willingly and enthusiastically putting in, because the length of the contract, it's worthwhile them doing that. We also looked at making it a higher value contract. So again, providers were more interested in bidding for long contracts of a decent price. Short-term contracts with small budgets often weren't seen by providers as worth their while, taking the time to prepare for the bid, submit the bid, set the service up, only for the service to be gone potentially quite quickly out to retender again. And in a climate of budget pressures, it's harder to create higher value contracts. So what we did was with Denbighshire was roll all the contracts into a single contract, which Newcastle and others have done already, where instead of having a contract for, say, teenage parents provision and for offenders provision and for single homeless, youth homeless, etc., just roll all of those together into a single contract, so that one tender is going out for a whole portfolio of short-term services that would all contribute to the prevention of homelessness. And in this sense, then, that would encourage providers to work together more effectively, to bid as a consortium. It would be very difficult for a single provider to operate all of those contracts, or that are contracts of that diversity, with that range of provision. So that would encourage, as I say, bidding by consortiums, which would, as I say, foster greater cooperation and joint working. So the contract, so the local authority followed that approach, awarded a longer contract than what it had done previously, awarded a higher value contract. And because it had less contracts to manage, it then became less of a problem for the council to have a decent contractual management regime with the supplier, because effectively the consortium lead did a lot of the actual management of delivery and performance monitoring and making sure people's standards were up to scratch. And then the local authority were able to have a conversation with a single organisation on behalf of the whole consortium. In this particular example, the supplier that won the contract wasn't the established providers in the marketplace, which again allowed the council to be able to, putting out to tender this longer contract of a higher value, attracted new bidders, different providers that weren't already operating in their local authority market, allowed them to see other types of providers, other ways of service being delivered. And on this occasion, they chose to go with a new supplier. That's benefited the council because this new supplier has brought new ideas, new ways of working, but has still worked alongside established provision, such as existing housing associations, to make sure people have got quality housing alongside the support that they're offering. So the council get benefits from that, and indeed the taxpayer ultimately, through better value for money, better quality contracts, and service users, the beneficiaries are getting better quality individual outcomes.
Really interesting, Neil, and I think, you know, there's certainly something here about challenging the status quo. You know, I think it's and not just, again, not just in this area, but certainly something that we see at Bloom is kind of in other areas. There's kind of often not quite the willingness to consider something completely different that will, you know, transform the way in which potentially services can be delivered in the future. So some really interesting points there. As I said, I think if there are any questions, please do feel free to pop them in the chat. I know there's been one around the slides, which will be, which I don't think we have any specific slides, but the recording will absolutely be made available to all those on the call. I'm going to move on now just to talk a little bit about Newcastle. And the work that Claire and the team are doing, and also kind of now in partnership with Neil through a recent project put in place through Bloom. So I'm going to invite Claire back into the discussion. I have got a quick question actually, which Matt has just popped in, so I will pick that up in a moment, but we'll run through this section and then we'll pick it up in the Q&A. So I'm going to invite Claire back in to talk about some of the work that Newcastle are doing, and in particular about the project of utilising the Rough Sleeping Initiative funding. So Claire, perhaps if I could hand over to you, if you could just go back to the start of the process, talk us through the project and what objectives you were looking to achieve initially.
Paul, can I just check, this is the work that we've asked Neil to carry out for us?
Yes, that's right.
Okay, so we have in Newcastle we have a number of Rough Sleeping Initiative funded services, projects that are currently in place, and we also have been successful in securing revenue and capital funding through the Rough Sleeping Accommodation Programme as well. So in Newcastle, I think to kind of give some context, we have a relatively small rough sleeping population. We average round about 5 people rough sleeping per day, but that can range from, you know, 0 people found per day to 12 people found per day. And as I mentioned before, we have some quite specific challenges around people who are either from outside of the area or who have access to accommodation but are choosing for whatever reason not to use it. So our interventions are very much focused around supporting people away from the streets and into accommodation, and also making sure they've got access to the right support to sustain them in their accommodation as well. We've also got some funding that is focused around a rapid rehousing pathway model, so very much looking at people who have come from the streets into accommodation, but then how can we support them through that housing-led approach rather than a hostel-led approach into accommodation that is sustainable but that also meets their needs. And I think what we are really, really mindful of is, because of those challenges, we wanted to ensure that we were maximising the value of those initiatives and actually really wanting to understand the difference that those initiatives were making. And independently, we thought it would be important, or rather we thought it would be important to have an independent review of the effectiveness of those interventions. And we've previously worked with Neil Morland before, who supported the City Council around the early stages and then the implementation of the Homelessness Reduction Act. So Neil is a trusted and knowledgeable ally, shall I say, and we were just really, really keen to work with Neil to try and understand how he could support us with that piece of work. So in Newcastle, we have Bloom as a partner who will broker with us around specific procurement activity. In this instance, it's around consultants. So what we've done is we've developed a work plan with Neil where we've set out what the scope of the work is, and then Neil has then interpreted that and has set out kind of what the activities are. And we've obviously secured Neil to work on this particular programme with us.
can I just pick up there? I think just from your perspective, Neil, just in terms of the project, what did you feel was kind of one of the biggest challenges that needed to be addressed here?
I think it's one we've touched on already, which is how do you create long-term arrangements to commission and deliver Ross sleeping services with short-term funding? That's a really tricky conundrum to work with. I did some research with Heriot-Watt University on behalf of the Local Government Association about this last year, where we published a whole range of advice which the Local Government Association has put forward to the then MHCLG, which very much again said local authorities want longer term funding settlements, and they want less bidding windows, and if they do have to bid, the time frame for submitting a bid needs to be longer, and the complexity of the bids need to be as straightforward as they possibly can be, with also at the same time, again, appreciating the government wants to make sure it's spending its money well. So it was really, for me, that's one of the most intriguing bits of this, is how to create long-term arrangements to commission and deliver Ross sleeping services with short-term funding, but also to make sure that also whatever future plans that the council has to deliver Ross sleeping services, that they're a cohesive suite of services, that they complement each other really effectively, they're not duplicating each other, and that they're really focused on ending Ross sleeping, which I know is a term used a lot, but we really have to be clear with people that Ross sleeping is not good for you, and that's an understatement. The mortality rate of people sleeping rough is early 40s compared to the population at large, which is early 80s. So Ross sleeping can halve your lifespan, and so there should be services that are really intervening in quite a proactive way and saying this is really not good for your well-being, and you need to get off the streets, and we need to get these interventions successfully in place with you. And that was key for me around that cohesiveness of services, and interesting to see how they might be going about doing that, and then also about looking at how we measure the impact of that funding. So the Newcastle City Council itself can be sure it's getting good value out of the money. Providers themselves can be sure. The government sees that and continues to invest in Newcastle, but also most importantly, the individual beneficiaries see the impact of the funding, and that they can relate that to themselves, either at the time or in due course when they want to sit back and reflect on their journey.
Yeah, and I think it's again an interesting point that you raised, Neil, about kind of the funding and often the kind of short-term nature of some of that funding. I'm interested, Claire, perhaps a quick question for you, just around how you approach the kind of the funding process in terms of, actually submitting your bid, receiving the money. Can you just perhaps talk us through that a little bit?
Yeah, so for all of the MHCLG grants, they generally provide a prospectus. So what we will do is we will use our own data, which will be a combination of quantitative and qualitative data. We'll look at case studies. We'll also look at information that we've had from our partners across the city to really understand what it is that we have a need for and what we have a gap in Newcastle around our provision. And we have a quarterly rough sleeping review process, which we involve partners to contribute to. So that helps us to understand kind of what's going on an aggregated basis. But on a day-to-day basis, we have an outreach team who go out and will engage with people, and we have a rough sleeping coordinator who is very much focused around concluding people's time on the streets. So we know we've got quite a lot of information about what it is that we've got in Newcastle, but also where those interventions, those services are failing to support those people. So we always try and shape what our need is in accordance with what it is that MHCLG are actually offering the funding for. And then it's a combination of working with partners, and that can include our commission services. It can also include our Street Zero partnership. So Street Zero is a partnership that was established by the Newcastle Homelessness Commission, and it brings together organisations from across the city who will all have a collective responsibility to end rough sleeping in Newcastle by 2022. And that includes our commissioned homelessness providers, it includes the police, it includes health partners, our drug and alcohol commission services. It also has representatives from the business sector and from our kind of street rangers as well in the city. And it's about understanding from them exactly what they're experiencing and where they feel we need to make a difference. And then working with our MHCLG advisors, as I said, we've got a really good working relationship with them. So it's very much around kind of explaining what we believe our need is and then how we can develop our bid to respond to that. We have our arm's length managed organisation, which is Your Homes Newcastle. So they provide all of our social housing in Newcastle on behalf of Newcastle Council. And we work with them around what accommodation they can bring to bear from their stock. So from the rough sleeping accommodation programme perspective, we've actually brought some long-term voids back into use with a fairly small capital investment of about £3,500 per unit. So it's all very much around understanding what our local need is, what our provision could be in terms of how the market can respond, and then working up our bid to ensure that what we're asking for is appropriate, really, Paul.
Yeah, thanks, Claire. And I guess, you know, this is for those that are on the call today, perhaps thinking about their own kind of approach and how they would do that. Some really interesting insight. So thank you. I guess just a sort of final question, perhaps for you, Neil, in terms of next steps for this project and the kind of the next milestone. Where is the project and where is it going, I guess?
Good questions. So we've looked at a range of literature, that sort of some authoritative literature that demonstrates what works around providing interventions to people who are experiencing street homelessness. Newcastle itself has got hundreds of good quality evidenced research as to what works in the city and what doesn't, that's a really helpful platform. We know that from recent research published by the government that 71% of people experience street homelessness experience hidden homelessness beforehand. And so there's some learning there, in the sense that actually when we talk about the prevention agenda, for many people, actually that needs to be looking at then what can we do at the point that people are experiencing hidden homelessness. How can we intervene there to reduce the overall levels of street homelessness? What we're seeking to do, our next sort of big step, is seeking to speak to people. Having done some literature stuff and some statistical analysis, we're really needing to speak to some providers that are involved in the current provision, and also individuals that have benefited from the services Newcastle have commissioned, to get their views to inform our findings, and because those that deliver the services and those that benefit from the services, their voices have got to be heard in this process as much as the Commissioner, Newcastle Council's view have also got to be caught as equal, and all three of those need to inform the findings in a fair way.
Yeah, so clearly, a lot to do, a lot of people to involve in this, and I think that whole concept of sort of early intervention and prevention, I think, is a really important point. Sitting alongside your kind of, what does the data say? What's the impact? So, look. Really great insight, Claire and Neil. Thank you, because I think it's a really interesting project. We'll be obviously very keen to kind of see the outcomes from that, and obviously we'll be able to hopefully share that with those that have attended the call today through some sort of case study through Bloom. But I just want to pick up a couple of things. There was one question from Anne, and this was about your case study, Neil. Mm-hmm. Anne had mentioned about measuring improved outcomes and value for money expectations. Have you got a kind of a view on that? Has that kind of been quantified yet?
Yeah, I mean, I think when you're measuring something, it's important that you measure it in 4 dimensions. People that know me will have heard this from me before. You measure quality, quantity, effort, and effect. One of the criticisms of the national data set on street homelessness published by the UK government is that it only measures the quantity of people sleeping rough. It does talk to us about the quantity on any given night and the quantity of people by gender or by ethnicity, but it doesn't, that data set doesn't talk to us about the quality of interventions that have gone in place. It doesn't talk about the effort made to help those people, and it doesn't talk about the effectiveness of those interventions. So the national data set is limited in the fact that it's only measuring rough sleeping by one dimension. So in anything you're commissioning, you're wanting to measure the quantity of people that are being helped, the quality of help they're getting, measuring the effort that's going into delivering that help, and then measuring the effectiveness of that help. And then you'll get a true picture as to the performance of something. And ideally, across those 4 different dimensions, you only want in total 16 performance measures at the very most. Otherwise, you're just monitoring to death, and everybody's going to get fed up with being monitored to death, and you're never going to collect it all properly. No one's ever going to read it and analyze it properly, and it's just a waste of everybody's time. In terms of demonstrating value for money, I think there's a number of things that we need to do there. One of those is looking at what it costs to fund a rough sleeping intervention, but then comparing that to other relevant local authority areas. So for Newcastle, you compare it with other core cities, for example, or other northeast local authorities, allowing, as you do that comparison, allowing for local context, local policy choices, taking that comparison into account with local context and local policy choices. But also, when we're looking at value for money, we also need to consider what were the benefits to the individual, and is the cost of the intervention and the subsequent benefit to the individual, is that worthwhile, or is the cost of that intervention to that individual too much, and we need to look at reducing that cost in some fashion. So there's an individual cost benefit analysis to be done there that has to use qualitative and quantitative evidence, as well as then actually looking at, to say, at actual unit cost and doing a realistic comparison of unit costs.
So I think to summarize, Neil, it's not as straightforward as one number against another. But
correct.
Clearly there's a lot of aspects to this that would define what is value for money, and I guess from any organizational perspective, it's about setting that expectation up front and being really clear on what the expectations and the objectives are. So yes, really interesting, Neil, thank you. I've just had another question on Newcastle, one for you, Claire. Are Newcastle still facilitating everyone in for rough sleepers? If not, what does the SWEP provision look like? Keen to hear alternatives to night shelters, if they have any, or and it's an anonymous attendee actually. They're trying to avoid the use of night shelters in their own area. So any alternatives, Claire? Over to you.
I mean, our approach pre and post pandemic has pretty much always been everyone in. So we've been fortunate in Newcastle that politically we have been able to continue to commission relatively high levels of accommodation in the city. We currently have, excluding our domestic abuse refuge, 101 beds of supported accommodation, and that's a combination of short-term relief accommodation, which
she's gone.
We lost Claire. She was just getting to the good bit. Yeah, indeed. Well, while we wait for Claire to reconnect, we hope.
I'm back in.
Hello, Claire. Hi. Welcome back. Just in time.
Sorry, I got kicked out.
I was starting to panic that I'd have to answer the question. So welcome back.
So I was just saying there that we've got relatively high levels of we've got high levels of accommodation in Newcastle, and So we always seek to make an offer of accommodation to anyone who presents as literally homeless. We also offer, we also have a no second night out approach. So effectively, even people who are either no recourse to public funds or who don't have an area of connection to Newcastle would still be offered accommodation if they were found rough sleeping on a particular night. And obviously the following working day, we'll be looking to either reconnect them or source an alternative offer for them if they were in fact no recourse to public funds. So we always, as I said, are looking to maintain sufficient accommodation, and we work with our providers to try and create headroom in our services, which effectively means we're looking for around 5 beds per night to always be available, and effectively how providers can have a move-on process that always creates capacity within our system. But nevertheless, we did find there were some nights, especially during the early stages of the pandemic, when everyone in was absolutely the priority, and we do something also during our SWEP times as well, which is a sit-up type of offer. So we don't have, as I said, we don't use a night shelter, so we don't have any shared sleeping quarters. We don't open up any church halls or anything like that. But what we do is we ask providers to basically repurpose communal areas and provide a sit-up arrangement in that space. And that can be anything from a camp bed to a sofa, something along those lines. It's very much kind of a last resort accommodation offer, but that's how we would respond in a SWEP environment if we were completely out of our other standard accommodation offers.
And I think it's an interesting one to pick up, actually, just thinking about those severe weather events and actually the number of those events, and whether there are going to be kind of more as we move forward with obviously with climate change and everything else. So it's a good practice to be in, to have a means of supporting that.
Yeah, I think just the thing I would add to that, Paul, sorry, is in Newcastle we don't use bed and breakfast or hotels to discharge our homelessness duty, and we haven't done since 2006. So that is it's something that we're incredibly proud of, but it's also something that we work very, very hard with our providers to maintain sufficient capacity in our accommodation services. So the only time that we've used hotels or B&Bs was to accommodate people who were no recourse to public funds as part of Everyone In, and we basically worked with two hotels in the city and secured 13 bedrooms effectively on a dinner bed and breakfast basis. And those people were then supported with their immigration status to either secure employment if they were economic migrants, or if they perhaps had were destitute asylum seekers, in the sense that all of their options had been exhausted, working with immigration specialists to try and get people accommodated.
Yeah, and again, a tricky area, but clearly kind of something that is tried and tested, and if is required. There's a question that's just come in around experiencing difficulties in recruiting support staff, particularly for night cover. High costs, turnover, use of agency, very, very familiar challenges, I would imagine. But I think the question is here, are others experiencing those challenges, and how are they being resolved? I guess, Claire, perhaps a question for you. Is that something you've experienced at Newcastle?
Yeah, we are aware that some of our providers have experienced some difficulty in recruiting staff, and what we found during the pandemic was that staff who worked in float and support type roles were redeployed into accommodation services, just to ensure that we could maintain service provision whilst people might be off poorly, or self-isolating. But definitely, I think providers are finding that their sessional worker pools are becoming quite exhausted now, and you know, they are just working with agencies to try and secure resources insofar as they're able to. To be honest, I don't think there seems to be a magic solution. What we have done is we have made funding available through our infection control grant that we've had from the DHSC to actually support providers around additional staff that they might have had to bring in because of things like self-isolation, as well as obviously just meeting costs around, you know, PPE and additional personal hygiene provision and things like that. So we've tried to support providers in that way, but I know that might not have always been the case in other authorities.
I think some of this comes back to comes down to what we pay people. You know, the job of working in supported housing is challenging, it's complex, it can be stressful, and many people could get paid more working for Amazon, driving lorries. There's a big lorry driver shortage. If you're going to get paid 40 grand a year for driving a lorry, compared to in some services half that as a support worker. You know, we know there's also people exhausted leaving the NHS. We know care homes struggling to recruit. So there is a sector-wide conversation that says, what's the value of this job, and what should we actually be paying people? And that's a difficult conversation to have, again, in a climate of constant public sector funding cutbacks.
Yeah, and there's no easy solution for that in this area or any other. I think, you know, a common issue across the sector, to be absolutely honest. But look, I really want to just thank Neil and Claire for their time today. Really appreciate you kind of taking the time out to be on the webinar, and to those that have kind of been involved and also participated today, really appreciate it. It's some really interesting questions that we've been asked. I think what we will do is we will be sharing the recording. We will keep in touch with you all about kind of the progress that Neil and Claire's project is making at Newcastle, some interesting outcomes to come. And again, look, thanks very much for your time today. And if there's anything that we can do at Bloom, or if you have any further questions for Neil, Claire or I, then please do feel free to get in touch with using the details on the screen. Thanks very much, everybody. Have a great afternoon.